My saying when I started was, the future's so bright, you gotta wear shades. So I think I need to buy some new shades.
Oh, that's mighty kind.
Good day, my name is Dr. Bonnie Bragdon. I'm your host today of the Veterinary Insider. The Veterinary Insider is the podcast for veterinarians and anyone who wants to keep the veterinary profession independent and veterinarian owned. Today's podcast is powered by the IVPA. Check us out at iveterinarians.org. The IVPA is the only association dedicated exclusively to working with independent practices. My favorite benefit is the teleradiology benefit. Independent veterinary radiologists serving independent veterinary practitioners. So our guest today is Dr. Arnie Goldman, and Dr. Goldman is going to tell us about his journey to becoming the president of the Independent Veterinary Practitioners Association and what awesome things we can expect to see in the future. But Dr. Goldman, I'd really like to start. What inspired you to become a veterinarian?
Well, I mean, that, like so many of us, it goes back to my childhood. I had a natural affinity for animals, and my father, who's been passed for a number of years, he had a soft spot for animals as well, as did my mother. So there was the feeling in the family that it was just something that was part of us in our hearts. And so, I absorbed that, and given a choice as to what to do after college, it was just a natural thing. I don't think I ever wanted to do anything else that I can think of right offhand. Yeah.
So do you have a favorite pet, a favorite all-time animal, whether you owned it or it was a patient, just a favorite animal that you will remember for all time?
Well, that's a great question. You can see the pictures behind me if that's going to be visible. The top picture is my first Boston Terrier as an adult. His name was Spike, and in the end, I ended up having 7 of them over the last 28 years or so. And there's a picture that is around my family of me as a baby with my uncle's Boston Terrier. And so I guess they've been part of my life ever since, I was a little one myself. So that is that story. I'm actually looking for it now. But my Boston Terriers have been, just part of my life for just forever.
So I'm going to switch gears here on you, Dr. Goldman. All right, so contentious topic. What do you think about corporatization? What is happening with the veterinary profession that all of our clinics are being gobbled up by corporates?
Well, I think, so it's a complicated question, and I may be a little long-winded on this. First of all, there are still at least 5,000 independently owned practices in the country, and then a significant number of ambulatory clinics, house call practices, large animal equine practices. But that said, I think that the unfortunate thing is while corporatization may have been inevitable, there were so many pending retirements of veterinarians of my generation and no willing buyers in many cases, that was an inevitable thing. But that said, we hear the stories, you and I have talked about how in these larger practices, what AVMA calls national practices, there's a certain loss of that relationship, the veterinarian client patient relationship that we hold dear and is so fundamental to veterinary practice for a bunch of different reasons. In part, it's because in large practices like that, many times you don't get to see the same veterinarian every time. There may be, I hate to use blanket statements because I know there's exceptions, but that said, there can be pressures to so-called upsell, where the veterinarian is encouraged in a variety of ways to push things that are, you and I might think are optional, or I don't want to say unnecessary, but not immediately necessary. And that doesn't occur everywhere at all the time, but sometimes. And there's a lack of, we're inserting a fourth party into the VCPR, the veterinary client-patient relationship, by allowing management that is not veterinary in nature to get involved in decision-making it may not be always immediate decision making on a given pet. But let's just say they choose not to buy a piece of equipment or a supply that we consider essential to our daily work. That certainly puts a limit on the way practice occurs. And those kind of things do occur. And again, not everywhere, not all the time. And I guess on the profession itself, I think that large practices like that, these so-called national practice groups run by corporations that are not veterinarian controlled, there's a tendency to make permanent associates out of young veterinarians. They're enticed with signing bonuses and relocation benefits, and the money is too good to say no to. But then when they get there may be a degree of mentorship, which is expected when you're new, and that doesn't necessarily occur in private practices any better in every situation. But then there's a tendency to stall in professional development, where the young associate does a certain kind of rote work on a regular basis, but may not, in many cases, be encouraged to grow as a surgeon, to grow as a diagnostician. And that can lead to burnout and really a lack of professional development. And we hear, and this amazes me, we hear of younger colleagues who are leaving the profession early, and after all those years and all that expense and effort to get to be the one thing they wanted to be since childhood, and they become disillusioned and leave. I cannot conceive of that. Yet, if they go into a situation where all they're doing is the most mundane work, not to denigrate the medical necessity of vaccinations or cleaning ears or expressing anal glands, but these are not things that after you've done them 40 times, you're going to keep growing as a professional. You grow as a professional by taking on more challenging cases, by attempting procedures under the mentorship of someone else, and then eventually doing them yourselves. Watch one, do one, teach one is the old adage. So that's a long answer to a short question.
Yeah, no, Dr. Goldman, that was a really rich statement about the state of our profession, right? Things have changed so much since all of us have entered practice. What I would like our listeners to think about is checking us out at iveterinarians.org. We actually have a site where you can learn about practices looking for associates. And so independent practices might have that capability, that time to mentor and coach and teach more about surgery, or allow more of that career development and allow you to grow and change. And so again, check us out at iveterinarians.org and find that list of practices looking for associates. So Dr. Goldman, we hadn't really talked about it, but tell me more about what the IVPA, which stands for Independent Veterinary Practitioners Association, what is it that the IVPA does?
Well, IVPA is an association of veterinarians who believe in entrepreneurship as an inherent value of veterinary medicine. For those of us of my generation, and perhaps yours, you graduated knowing that you would likely, if you were going to stay in practice, not everyone did, but most did, if you were going to go out and work as a veterinarian as someone's associate, that you would learn, and then eventually either you would be approached to become a partner, or you might go off and start your own practice or buy an existing practice. But it was more common than not that a graduate veterinarian would advance in that way, in practice. But today, it seems less so. And so, and there's a sense that we hear this of younger veterinarians, well, I want to do my work, but I don't want to own a practice. I'm afraid of the hassle of it, the difficulties, and I already have a great deal of student debt, and I'm fearful of taking on more debt. And I think what's lost in that thought process is that these young people will not have the professional autonomy that we had, that they may not realize that by allowing themselves to be absorbed as an associate in a national practice, their growth has, unless they end up as one of the bosses, the growth has limits because they're needed to do a particular job. And so, I mean, the I think, the fastest way to the kind of satisfaction from the profession, the autonomy that you want, the work-life balance, if you will, that comes from ownership, because you have complete control over how your practice life goes. And yes, there's an element of delayed gratification in it. You have to be willing to say, okay, I'm going to work pretty hard in the beginning, and in 2, 3, 4 years, I'll have another associate of my own, and then I can take it easy if I want to do that. And if I want to go to a conference, I'm going to take the 2 days off and go, and know that I have the freedom and the right to make that decision. You don't necessarily have that much freedom working for someone else.
Yeah, Dr. Goldman, I'd actually like to dig in deeper into your personal experience. And so can you tell us about your journey to practice ownership, and actually really, what do you like about ownership, and what do you struggle with in your current scenario about ownership?
All right, well, that's another well-packed question, Bonnie. You're very good at this. My journey is this. I graduated from the University of Florida in 1986. I got a great education. I went and did a formal rotating internship at a place that was called at the time South Shore Veterinary Associates, owned by a well-known New England surgeon named Bill Henry. He's kind of very famous within the surgical college. And there were boarded internists there, a dermatologist. And so I got trained under those people. And I was told before graduating, and it proved to be true, that year would give me 5 years worth of experience. So coming out of that internship year, I had a lot of confidence. I felt I could do anything, and I didn't have any limitations. And then I wasn't sure where I wanted to go. In those years, I had lost my father, and I didn't want to be too far from my family. So I ended up in the New England area, and I worked as an associate in a few different roles, eventually in emergency and critical care practice, and I ran a practice of that type as a manager. I wasn't the owner, but I was a quasi-owner in that sense. And I took it to heart, and I ran it as if I did own it. And I realized in that experience that I wanted to own my own practice. There weren't a lot of what I considered at the time high-quality practices for sale, and I just started saving money, and eventually I had enough as a down payment to be able to get a loan and start a practice from scratch in a commercial building that I found in a semi-rural community where I still am now. And so that was my journey to get here. And it's been great. I mean, you have daily frustrations with anything. I hear from colleagues that their biggest headache is employees, but I haven't had that experience. I have 3 of the people I have now have been with me in excess of 25 years. And I'm not always easy to work with or for, but we practice medicine in a way that I think they can always be proud of. We do the right thing, we tell the truth. Things don't always go right, but we own up to it. And if things are unhappy at some point with a client, we strive to make it happy, and they have a lot of control. My technicians, they do practice at the top of their degree. I don't micromanage them in the slightest. And so they control how things go. And I often joke that I work for them, and in a lot of ways I do. So, and that works out just fine for me. Clients are difficult sometimes, but for the most part, they're good people trying to do the right thing. And I have the fortune to be in a community that's, I wouldn't say it's the most affluent, but it's not a impoverished community. So for the most part, my suggestions are followed, and that's not a frustration for us. We get to do good work most of the time for good people. So I can't complain about that at all. And I've seen a lot of my colleagues, my age, in our 60s, sell their practices, sometimes more often to corporate owners. And the majority of the cases, not all, but in the majority of my close colleagues, I would say they ended up unhappy in some way. They got their money, but they were not treated well. And in the end, despite their written agreements, got pushed out prematurely. They were just not treated in a professional manner because it didn't serve the economic needs of management. That is what I gather from at least two very close colleagues who I know well, and I know the details of their situations. I have a couple that are happy with what they chose, but I'd say the majority are a little jaded now. They wish they could have sold to an individual, but at the time there wasn't a willing buyer. And it was time for them to get out. Well, the other thing I learned is I'm not ready for retirement. I don't have my associate has not expressed an interest in ownership, but I'm not going to go down the path that those other colleagues went down.
Yeah, so you make an interesting point, right? As veterinarians exit, they have choices. They can choose, depending on the size of their practice, they can choose to sell to corporate, they can choose to sell to an individual. One of our previous episodes with Dr. Mark Helfet really went into some good advice on selling specifically to an individual and how to support younger and newer veterinarians in their journey towards ownership. So proof is in the pudding, Dr. Goldman. I love what you said, that owning a practice gives you flexibility, gives you autonomy. Tell me about your recent travels, because you've been traveling quite a bit, even though you own a practice. So tell me about your travels and how you managed that as an owner.
Well, relative to, I've been involved in organized veterinary medicine for many years. Probably, it really got started in '98. But I've always had the freedom to take time off and go attend meetings, or I made the time. We juggled appointments. And once I had an associate, it got a little easier, but I had done it in the meantime. So recently I've traveled some for IVPA, and I never really talked to you to fully answer your first question. So we'll come back to what IVPA is trying to do. But my recent travels, this summer I was in China and Japan. Japan was a vacation that I promised my wife, but China was a duty I took on for AVMA. So I represented the United States at the World Small Animal Veterinary Association, which is a world group. It's an association of associations. And what they mostly do is try to set reasonable practice standards for small animal practice that can be used the world over, whether it's a developed country or a developing country. Because developing countries have very different challenges. We're busy concerned with, whether our radiography is adequate. They can't even get basic drugs sometimes. And so there's ways of, it goes to that spectrum of care idea that's been circulating lately, which is a very interesting one. So that was one place I've been. On behalf of IVPA, I was recently at the New England Veterinary Medical Association, where I played up what we're trying to do and encourage people to join us. And just this past weekend, I was at a conference that's not only directed at veterinarians, but also at lay people interested in animal care, called the National Animal Interest Alliance, which is run by a woman named Patty Strand from Oregon. And they have a focus on keeping the right to use and own animals in human hands as a right, basically, because that the animal rights movement has a little bit different take on that, and so they push back a little bit against that. They're pro zoo, they're pro purebred breeding, that kind of thing. So I did speak about IVPA there as well.
Dr. Goldman, it's really interesting and exciting to hear about the richness of all of your experiences, right? And it's really encouraging. We know from research, especially done by the AVMA, that one of the greatest drivers of well-being with veterinarians is joining an association. You named quite a few that are really helpful to veterinarians and even animal owners. So shout out, join us, take a look at iveterinarians.org. Check out AVMA, lots and lots of tools for career development. Again, Small Animal Veterinary Association. Lots of great ways to give back and volunteer there. And the National Animal Interest Society, really love what they do as an owner who enjoys using horses and working with my horses. So you are proof in the pudding. You are living the dream. You can own and have a life and give back and be connected with your colleagues. And so, yeah, I'd really love to hear, what does IVPA have planned for this year? What can we expect from the board that's going to be great?
Well, IVPA has been a little bit of a transition, and I'm not the founder. You are, but without you, we wouldn't be here today. But I think IVPA was an idea whose time has come, and the goals that you originally set out for it, being influential in the profession at large, encouraging entrepreneurship and private practice ownership, those are all values worthy of preserving and encouraging. And so what IVPA is doing now, we're twofold. My main goal was to sort of reorganize a little bit and give you the time you needed to pursue your other interests in your own life, while at the same time pushing forward this idea that entrepreneurship is an inherent value to veterinary medicine. The way I see this going now is I'm working hard with my board colleagues to build the membership, to try to get to the threshold necessary to qualify for membership in the AVMA House of Delegates. Really, that was a goal you originally set out. I didn't quite realize that, or if I did, I had forgotten that was something you had always had in your mind. But I'm doing what I can. Having come out of the AVMA Board of Directors as treasurer, I have some connection with them, and it turns out that they also want us to succeed at our goal. Large associations like AVMA, as well as the state associations across the country, they represent colleagues who work not just in independently owned practices, but also in national practice groups. They have to be judicious in how they approach advocating for entrepreneurship, because they got to be fair to all members. So it isn't really in any of their wheelhouse to focus solely on entrepreneurship, on practice ownership, on independent ownership of practices, if I am reiterating. And so they need a voice. They need a voice that can speak for our members and the kind of practice owners we are. And so I have to thank AVMA for the help they've given me up till now, and will continue to do. I really respect the trust, and I work hard to make sure I don't violate that. They have to be very even-handed, and I understand why, and I don't feel at all awkward about it. They have a much broader membership than we have. We have a very focused membership. But I think they recognize that they need a voice in this realm, in the private practice, independent private practice ownership realm. And so they've been giving me quite a bit of support. I got help from one of their attorneys rewriting our bylaws, and their economics people included us in the recent Veterinary Business and Economic Forum. Some of our board members participated as panelists. I was there observing and listening. And so I've gotten quite a bit of encouragement and help, and I'm optimistic that by the time my 2-year presidency comes to an end, if we don't achieve that number, I think we'll be a lot closer than we've been. And then, I'm prepared to submit the application the very second we hit that magic number. And I think we have a good chance of being admitted. The House gets to decide who is admitted, but there are other organizations that are not species-oriented like we are. The American Animal Hospital Association is an example of an organization like that, and there are others. So, I think we have a good chance at it.
Yeah, so Dr. Goldman, you did a great job explaining the reasons to join multiple associations, right? You want to join AVMA as a veterinarian because it gives you all of the access to benefits across so many areas. It also gives you a voice. The AVMA speaks for veterinarians almost worldwide. Your state association is the way that you influence AVMA and you influence your state goings on. But if you are really an independent owner, you want to become an independent owner, we really hope that you check us out at iveterinarians.org. Lots of podcasts, lots of guest speakers who've talked about how to become an owner and what the value is. And so, Dr. Goldman, I'm going to put you on the spot here. Hopefully you've done your homework. So, what's your favorite IVPA benefit?
Well, it's for me, as a board member and a leader, I think the benefit is having close access to other colleagues who are like-minded. the networking element. Now we have a number of concrete benefits. Teleradiology program is one in particular that is very, very worthwhile, and it involves access to a teleradiology service with a significant discount and expert radiology opinions on radiographs. And I was trained to read my own radiographs, but today most people are having their radiographs second guessed a little bit or reviewed by boarded radiologists, and so a program like that is well worth it. So it's easy to say that would be my favorite. I will add, IVPA does have a number of individual practice benefits, but I would tell my colleagues looking into joining to maybe think of it differently, that while these benefits are real and have value, in the long run, if you're a 35 or 40-year-old owner and you hope one day to retire and sell your practice to an individual rather than a corporation, for all the reasons we've been discussing, building this culture of entrepreneurship back, influencing the profession itself, to me, that's the larger purpose of IVPA. Achieving membership in the House of Delegates eventually will give us a voice within the profession, a standing in which what we say will be talked about on VIN, talked about on DVM 360 and other veterinary media places, and further will give us more regular and direct contact with students, get them hearing what we have to say, get them thinking about it at an age and at a stage of their career when they're still open to all sorts of ideas. And so, to my mind, that larger level, what some call the emotional reason to join, to build that back and to alter the profession such that ownership is, considered a wonderful thing and not an unwanted challenge. That's the bigger purpose to join.
Yeah, and you bring up a good point, Dr. Goldman, that a veterinarian can actually donate to IVPA, right? So you can become a member. You can also donate if you have a favorite program or a favorite benefit or something you want to help IVPA accelerate. Go to our website, iveterinarians.org, reach out to our staff, and we can walk you through how to make a donation to help make sure that entrepreneurship and ownership continue in the profession.
No, that's absolutely right. It's really a matter of us banding together to preserve what we were gifted with upon graduation, a veterinary profession with all sorts of options. And, ownership was prominent among them and should be, and I hope will be again.
That was perfect. So, next question. Tell me more about the House of Delegates and the AVMA and how that works and why IVPA wants to pursue getting into the House of Delegates. What does that mean?
Well, the AVMA House of Delegates is made up of representatives from every state and the territory that makes up the United States. And in addition, at present, there are 18 allied groups that are also members. And these are among our larger focus, as I call focused organizations. For example, the American Association of Equine Practitioners has a delegate and an alternate delegate in the House, as does all the species groups, bovine, feline, and then lab animal medicine. The uniformed services, they have a member in there. American Animal Hospital Association. And the criteria is that the organization has to have a particular and unique focus within veterinary medicine, and also it has to have at least 1% of the total membership that AVMA has. And of that 1%, 90% have to be AVMA members. So currently AVMA has 105,000 members. So what that translates to is we would need to have 1,005 members to qualify, and 90% of them would also have to be AVMA members. And we also have to have a unique focus, but we do. We are the only organization solely focused on developing that culture of entrepreneurship and supporting independent private practice. And so that makes us unique. And then again, once we're there, then when issues arise that affect practice culture or veterinary medicine writ large, we will have a voice to say, hey, we support this, or no, that discriminates against the independent owner for this and this reason. The national practices, with so many associates and so many people, naturally already have a fairly large number of involved people who are in leadership within AVMA. And there's nothing wrong with that, but we should have an equal opportunity to be able to be represented. And because the profession's changed so much, it's important that somebody be there that can speak specifically for the needs of the private practice owner. And the state associations, just like AVMA, as I said earlier, they have to be careful because their membership includes all kinds of veterinarians, and our membership is a fairly unique group. It didn't used to be so, but it's certainly so today.
Yeah, I have a quick story to tell that really, really inspired me to found IVPA, and that was years ago when I was working in industry. I actually served in the House of Delegates representing veterinarians who work for industry. And I heard a veterinarian in leadership at a national practice who has thousands of veterinarians working across the country who clearly stated that if AVMA would just give this national practice discounts on membership, they would actually require more of their employees to join. Not only would they require more veterinarians to join, they would also require them and give them the time to participate in political activities. And for me, that was a very scary thought, to think that independent owners were going to be taken out of that conversation.
Well, and they were going to be given then almost a second-class status. I was on the AVMA board as treasurer when some of those conversations have come up, and I can tell you that they understand that that's not something that will unify the profession. If anything, it'll tear us apart. So while I can't predict with 100% certainty the future, I can tell you I am aware that that is not going to happen.
So I'm just excited that you're taking over the reins. You're bringing IVPA into the next phase of its existence and helping to solidify that relationship with the AVMA. So I'm really, my saying when I started was, the future's so bright, you got to wear shades. So I think I need to buy some new shades.
Oh, that's mighty kind. I couldn't have done any of this without, all the work you did in the first place. So my hat's off to you.
So who's in the background? I hear some dog noises.
Yes. Well, you've got my current 1-year-old puppy right here.
Oh, what a cutie.
This is Yogi.
Yogi, you're just very cute.
He is, but he's still young and he's a pest.
They all are. What do you think, Yogi?
He's bored.
What do you think? He's bored.
He's bored. I have him in a crate right now because he was ill-behaved earlier, jumping up on my manager and pinching her fingers at a door, so he's safe now.
He's in jail for a short period.
Well, he's under control.
All right, so what would you tell associates who are maybe, on the trying to decide whether to own or stay as an associate? What would you say to make them want to become practice owners?
Well, there's a lot of things I could say. I guess I would say later on, when you look back on your career and the opportunities that you gave yourself, did you explore every opportunity that was out there? And it's to, even if you have to take time off for personal reasons, when you look back on your career, are you going to be able to say you made it all you could have, or will you have regrets? And so there's no freedom like working for yourself, because ultimately it's not always easy, but you get to make your own decisions and chart your own course. I had it in my mind that I could practice a style of medicine that I didn't see much of back when I was starting out. Now, of course, a young associate may look at me and say, oh, look at this old codger. he still, still uses corticosteroids or something. But, it's funny, everything old is new again. Now the use of corticosteroids is now being touted as less problematic than some other drugs. And of course, you see it come around again. But in any case, life comes along with work. You can't really separate them. And when I hear the phrase work-life balance, it's almost a little perplexing, because work is part of life. It doesn't have to take over your life. And if you try to keep veterinary medicine at arm's length, then you end up missing out on all sorts of opportunities that you would otherwise have. And there's a time and a place for everything. I mean, there's nothing wrong with working 5 years, taking 5 off, and coming back to it, and then considering maybe you want to be an owner at that point. There's no rule that says you have to take it on at a certain point in your life. I say that because I recently had conversations with people who were pointing out that, the profession's changed, the makeup of the profession's changed, and some of our younger colleagues need to take personal time off, sometimes for a few years, to make their lives work out. It doesn't have to take over your life, but I don't think it precludes ownership. And there's nothing more free than being able to, if I want to go to a conference this weekend, I ask my receptionist to reschedule everything. And she does it because she knows that I asked her to do it, I don't do that very often. In fact, I never do that because I plan ahead. But, it's been so rewarding to have my own practice. It's been rewarding to have had the freedom to be involved in organized veterinary medicine. And veterinary medicine is not the only thing I do. I have a family, and I fly a small plane. I have time to do all those things. In fact, organized veterinary medicine has given me opportunities to fly more than I otherwise would, because every now and then I get to fly to a meeting. And that's been really fun.
Well, Dr. Goldman, you really, I think, have highlighted the diversity of options for veterinarians, right? The breadth of what it is that we can do, and how much, as we develop in our careers, we can become a part of association and organized medicine, and how much that can not only help us give to the future, but how much it gives back to us. And so if you're wanting to own, if you do own, please check us out at iveterinarians.org. Feel free to reach out to our support team, Pam Stevenson, and all of her help. I'm sure you can always get in touch with Dr. Goldman if you have a specific question or need, or you just want some advice. Learn more about AVMA and all the wonderful tools they bring at avma.org. Last question. I'm going to wrap up with this question, Dr. Goldman. All right, this is controversial. Is there a shortage of veterinarians looming, or is there not? Are we going to have too many veterinarians in the future, or not enough?
Well, the AVMA commissioned a study, a BACI study, which just came out, putting that to bed. It's not so much that there's going to be too few veterinarians. There's going to be plenty of veterinarians. I mean, we've got 30 some odd schools now. There's going to be 40. There's 10 schools in development. So we're going to have a lot more graduates every year. And so the study indicates that the number of veterinarians will reasonably approximate what is needed. The question that is unknown and unknowable is, what does full-time mean? Will these veterinarians be willing, as they get into different phases of life, to work, how many hours a week? I don't know the answer to that. At my generation, working 40 was considered too few. Now, some consider it too many. So, because they don't want to put that many hours in, they've got other things in their life that they have to focus on. And that's all well and good. But according to this study, which really just came out, and you can find that on avma.org, the number is going to be adequate. And I think that, I don't want to speak disparagingly of colleagues who choose to work for national practices. That's never my focus. But I think it's in the interest of some of these larger corporate groups to have a lot more graduates for the simple reason that they in the long run, they can pay more people less, and economically it works out better for them to have a larger number of people that are not quite full-time, and they can shift them around among different locations and that kind of thing. I mean, I'm generalizing here, and it's just an observation I'm making, which also goes to this, if you want to talk about this proposal out of Colorado for the mid-level practitioner. Think about that. There's going to be this program that's going to be 2 years in length with a modest amount of hands-on training. Most of it's online. And then these so-called mid-level practitioners, what Colorado is calling veterinary professional associates, I think, or veterinary practice associates, they're going to be entitled in Colorado to go out and practice all on their own. When you look at who is behind this, you can see that it is individuals very closely associated with the national practice groups, or some of the national practice groups. So I can envision, as an example, I was discussing it with Pam Stevenson earlier, you can envision what would have been, let's say, a 10-doctor animal hospital, all right? You can envision a practice like that having 2 veterinarians and 12 of these veterinary practice associates working under them, doing all that work. And does that really serve the public well? That's really the question. Anybody can learn to vaccinate and clean an ear, but not everybody's going to be able to look at a dog, see a pendulous abdomen, muscle wasting, a thinning hair coat, and hear the history of increased thirst and urination, and know that there's a high likelihood that Cushing's disease should be on the differential diagnosis list, along with a number of other things. I don't think you can train somebody in a circumstance like that to be that kind of diagnostician. And that may well work for a situation in a national practice, but it's not going to work for the kind of relationships we want to have with our clients in a private practice. And so I see a bit of disingenuousness in the push for this. They're claiming that it's going to resolve problems of veterinary deserts and access to care, but I think they doth protest too much.
So, Dr. Goldman, I think the message I'd like to send to any animal owners or pet owners who may wander on this podcast is that really, when you are at a practice, make sure you ask for the other family doctor, the veterinarian. Make sure you understand who's taking care of your pet and who's driving that care, whether it's a veterinarian and furthermore a veterinarian who's on staff and maybe even owns the practice. And so as a customer, when you walk into a practice, make sure you ask all those questions and understand what's driving the care that your pet's receiving or your animal.
Very much agree, Bonnie. I think what the client really wants, besides competence, is they want to have a relationship of trust, with the key word being relationship. And to do that, it's easiest to do that with somebody who's got skin in the game themselves. They're a member of the community. They own the practice. Their personal reputation is tied up with the reputation of the practice, as well as that of their staff. It's buy local.
Buy local. Well, with that, Dr. Goldman, we're going to wrap up this episode of the Veterinary Insider, the podcast for veterinarians and others who want veterinary medicine to stay independent and veterinarian owned. Please check us out at iveterinarians.org. You'll learn about all of the yummy benefits that IVPA offers, as well as our growing relationship with the AVMA, and lots of good information about owning or starting or exiting practice. And so with that, thank you very much, Dr. Goldman.
Thank you so much for having me. I really enjoyed it.